Having lymphedema can be very frustrating. Very often you'll go to the doctor. You may have even investigated on Dr. Google and suggest that you may have lymphedema. You're very often blown away by the fact that he seems very uninterested or knows very little about it. It's not their fault in many circumstances. They were just not taught this stuff. It was not part of their training. Unfortunately, for you, the lymphatics are not sexy, but they are becoming more so. And lots of new science means that there is more learning and more to be taught at a much faster pace, which will ultimately improve care and treatment. For those of you that have been diagnosed with lymphedema and have been to see other healthcare professionals, you sometimes wonder why there is so little interest in lymphedema, and it's the same old thing. I, however, was hooked and I became a lymphomaniac in a very short time. It may be that within the GP's training and medical training that they will cover very little on the lymphatic system. Usually about immunity, which of course we now know is very important in what causes and continues to worsen lymphedema. In my nurse training, I did 1 page out of my Let's nursing book. However, for those who are interested in lymphedema, you'll find them embed themselves and immerse themselves and generally become true lymphomaniacs. The philosophy of the Lymphoedema Training Academy and Lymph Vision is that you should treat everyone as you would your own loved one sitting in front of you. We teach our students to be present, consistent, and caring. Sometimes when you have an expert lymphedema patient, like yourselves, it may be difficult for healthcare professionals sitting in front of you. They may feel new and be novice, and you have so much more knowledge that they feel, well, a little bit threatened. There are so many GPs and medics who are more than happy to hear the expert views of lymphedema patients. Lymphedema is a classic example of this. Leading the way by example and doing as much as they can for people with this condition. Maybe it's time, if you feel frustrated with the information coming from your GP or your medic, that you took a leaf out of their book and became a true lymphedema supporter of those living with lymphedema. Patient advocates add to the valuable knowledge of what's necessary for us to continue lymphedema to be recognised and on the government agenda, to help care not only for yourselves, but for future generations.